OCD comes in many flavors. It has, there's a range of different types of symptoms, and that is why actually OCD is one of the more complex and the more difficult and baffling disorders for parents and professionals to understand and recognize. The key types of symptoms really are similar in adults as well, and they fall into sort of 4 broad areas. They're not really categories, but we like to think of them as 4 areas. The first and the most common is contamination. So this involves, extreme fear of germs, illness, disease, death. And so that's the obsession part. The fear about it is the obsession. And the accompanying rituals are often cleaning, sanitizing, but also asking for a lot of reassurance and checking. Avoidance is also a big part of contamination OCD. So for instance, if a child is terrified of catching hepatitis, that child might keep washing their hands, might check expiration dates on the yogurt and on the milk, might keep asking their parents if their food has been cooked properly, and then may actually really avoid a lot of things. They won't touch doorknobs, they won't go near people that they think are sick. Those are the kind of main symptoms. The next grouping is what we call just right OCD. This one's a really tough one for parents and professionals to understand because it's very different. It's very different from contamination, and it really doesn't involve a lot of fear about something terrible happening. It's more about an intense sense of discomfort about how one feels in the moment because something doesn't feel right. Something is out of sync, out of order, it doesn't look right, it doesn't feel right. And so there's a strong urge to make things right again, and that's what the ritual really involves. For instance, a child might say, I bumped into this table with my left elbow, and now it just doesn't feel right, so I have to walk all the way back and bump into it with my right elbow. Now, this can take hours sometimes, so this is not just like quirky little fun stuff. For instance, and this can get kids in a lot of trouble as well. For example, if Johnny, bumped into Joey accidentally in the cafeteria line, and he says, "Oh, that doesn't feel right, so I got to go bump him again with my other arm." Well, he gets in a lot of trouble at school for doing what the teacher thinks is sort of, disruptive, unprovoked aggression. So that's just right OCD, and that can take, many different, manifestations as well. And then there are sort of harm obsessions that involve violence and bad things, dangerous things happening, where again, these are thoughts that just pop into someone's mind. I might take the knife out of the dishwasher and stab my mother. I might put my arm, my finger in the socket and electrocute myself. Or I have, when I go to bed at night, I see images of bloody body parts all over the place. And these are especially petrifying for children. And then one more grouping is what we call scrupulosity or morality issues, where children and adults are very concerned that they've done something terribly wrong, even though they're doing sort of everyday things. Now, we know when we diagnose and treat OCD that all of these things are really not true. So when someone is worried they've done something terrible or they're going to hurt someone, the definition of OCD is that that's not true. And so they're not going to do those things.